the doctors use the lasers also. We sometimes treat brown pigmented spots. We can use them to take out spider veins in the face. We generally on the legs will use an injection for spider veins, but the laser is useful for certain things. Right now, we don't have a laser that's for office use that's very effective for removing deeper wrinkles, but there are other options. The other options are fillers, which I'll talk about, Botox, a little more about that. Blue light we've already talked about, and that can be used for fine wrinkles on the face also, although in our practice we tend to use it more for the actinic keratosis.
And acne as well.
And acne, right. The non-surgical options include Botox and fillers. The filler we use most nowadays is the hyaluronic acid filler. Remember, we started out with the old beef collagen that we used for many years, and then they started making these synthetic materials out of hyaluronic acid, and that Restylane and Juvederm are the most popular ones now. Well, first, Botox uses the botulism toxin A. You're not injecting the organism, just the toxin, and it does block the neuromuscular activity in the muscle, and so what you're doing is paralyzing certain muscles in the face, and it's especially effective in the frown lines, glabella areas, and on the forehead. Hyaluronic acid is a natural complex sugar that's found in our bodies. It binds with water and it gives some turgor to the tissue, and it can be used to fill creases. Botox is not particularly effective around the mouth, so generally for wrinkles that aren't ready for surgery, we'll use a filler such as this. And these are this is an example of a patient that's treated with Botox. One thing, I mean not Botox, with the Restylane. One thing about the fillers is they don't, as you can see, completely remove every line, but they do fill them enough that they're not so noticeable, and your lipstick doesn't bleed when you put it on and all of that. Now, some of the effects of aging, which we have listed here, really aren't amenable to non-surgical treatments, and so we, in these cases, we think about doing cosmetic surgery. And some of the more common procedures we do include brow lift, blepharoplasty, facelift, CO2 laser resurfacing, and liposuction is also used in facial rejuvenation. This is just an illustration of the types of brow lifts. The coronal brow lift, which is illustrated on the left, is not used that much anymore. It left a long scar extending all the way across the scalp. And so now we would be more likely to do an endoscopic brow lift where you go in with a lighted endoscope and free up the tissues of the forehead and pull them up. The biggest problem with the endoscopic brow lift is you have to have some manner of anchoring the lift, and sometimes we'll actually use screws or something like that in the outer table of the skull to anchor it. So kind of everything has its advantages and disadvantages. I've had many people tell me that if there's one cosmetic procedure that made the biggest difference, it was blepharoplasty, because it gives such a freshening of look. On blepharoplasty, the issues more commonly in the upper eyelid involve redundant skin, and in the lower eyelid, puffy fat. So this patient is one of ours that illustrates those factors. Some even young people sometimes, because of their genetic makeup, will have issues that cause them to seek blepharoplasty. This patient had a lot of upper lid puffiness. One thing she had in the lower eyelids was very active hypertrophic muscles, and that was very hard to deal with surgically. I think nowadays we would tend to use Botox on the lower eyelids on a patient like this. This patient illustrates that blepharoplasty can be done not only for cosmetic reasons but for functional reasons as well. This gentleman had significant blockage of his visual fields from his sagging eyelids, so he had a upper and lower blepharoplasty and a bit of a brow lift as well. Now, facelift is, of course, been around for a long time. You read a lot of things in the journals about this type of facelift, the 1 minute facelift, the S lift, the string lift, and all that. And basically, they all do two things. One, they tighten the skin, and then secondly, they tighten the deeper layers of the skin. And some of the neuromodifications we do, others we don't. We haven't gotten into that string thing just yet. We tend to be a little conservative and wait for things to kind of settle out, because a lot of these things that are hyped initially, nobody's going to be doing a year or two from now because they don't hold up. So in the neck, we have issues regarding both muscle and fat. This is a patient that had a brow lift and facelift. She also was very good about doing the skin care and skin treatment, so she got a good result from her surgery. This patient had blepharoplasty and facelift, and this shows what a liposuction can do in conjunction with the facelift. Finally, I put CO2 laser in the surgical category because this is different from the type of laser you would use in the office. This laser penetrates into the dermis and causes tightening of the dermis itself, and generally we use some sort of anesthetic when we do this, and it's also like having a deep second-degree burn when you do this. So there's a extended recovery time from this. This is not something that you can do and go to work the next day. This is a full face laser resurfacing.